Welcome to today's webinar, Home Health Explored, Discovering the Right Home Health Solution. This webinar is hosted by Medical and Life Care Consulting Services, a case management and nurse consulting firm headquartered in Massachusetts. We're excited that you've joined us for this presentation. My name is Gigi Liggins, and I'm the moderator for today's webinar. This webinar is anticipated to run approximately 45 minutes, with an additional 10 minutes provided for questions and answers. Participant audio will be on mute throughout the duration of the webinar, and we ask that questions are submitted using the question and answer or chat feature within the Zoom webinar dashboard. Post-webinar, we will share how you can access this content for on-demand playback with a link to a short survey. Again, we're excited to host today's webinar, and we look forward to an opportunity to work with you. Let's get started. So today, we're going to talk about what does an individual need, what are the requirements, what are the options, and how to put it all together. Meet your presenter. Cynthia Bourbeau, President and founder of Medical and Life Care Consulting Services, has worked as a Massachusetts registered nurse, certified rehabilitation nurse, certified nurse case manager, and certified nurse life care planner for over 3 decades. Founded in 2001, MLCC provides life care planning, Medicare set-aside, legal nurse consulting, and more throughout the United States and internationally. MLCC also provides case management services throughout the Northeast region of the United States and a wide range of care consultation for catastrophic injuries. Cynthia is a member of the Association of Rehabilitation Nurses, the American Association of Nurse Life Care Planners, the International Association of Rehab Partners, and the Case Management Society of America. She is also a board member of the Certified Nurse Life Care Planner Certification Board. Cynthia, we're going to pass this off to you.
Great, thank you. And thank you all for joining us this afternoon. Home care and needs in the home can really be a dry topic. So I'm going to try to embellish it as much as I can and give you scenarios that have occurred during my experience as a nurse. So as I said, there are many different scenarios that can occur within patient care. The extent of the patient's injury, their age, their home status, all affect the amount of care that they're going to need in their lifetime. This talk is going to be about the basics that contribute to the decisions regarding type of care the patient will receive post-injury or illness. Oftentimes, when trauma occurs, patients in the hospital are at the mercy of their healthcare team and the circumstances of their health insurance policies. Being discharged to home without the appropriate care staff can be catastrophic in itself. This can often result in a swift return to the hospital due to complications if the right plan is not set in place. With catastrophic injuries, patients undergo extensive acute care followed by rehabilitation, which often puts them in a better position for more accurate services to meet their level of care. A comprehensive team often assists with recommendations for the post-rehab period. Case managers in the hospital, rehab, and in the community often determine what is needed in the home. Identification of the level of care needed is determined by the evaluations completed by the team of rehab specialists who treat them. One of these measurements is the FIM assessment. This is a functional and cognitive assessment that's done in rehabilitation to determine the level of care the patient needs and what their functional capacity presently is. As rehab professionals, we assess these areas on a daily basis, both in the hospital, in acute rehab, in subacute rehab, and in the home. And it can be an ever-evolving and changing scenario. In the FIM assessment, the patients are evaluated for all these things that you see on the screen. Their eating skills, are they able to feed themselves, grooming, bathing, dressing the upper and lower body, toileting skills, and if they're not able to toilet, bowel and bladder management programs, transfers from bed to chair, toilet transfers, shower transfers, and whether they're ambulatory or wheelchair level. Can they do stairs? And then cognitively, do they have the ability to understand what's being taught them or told to them? And are they able to express their thoughts and feelings properly? Social interaction, how they interact with people around them, any psychosocial problems, their problem-solving skills, and their memory. Next page. So assessing their home environment. So assessment of the home environment is not only about talking about the type of home that they lived in prior to the injury and what they're going back to. That's a big part of it. But in addition, it's an evaluation of their family and friend support. Is their partner physically capable of assisting in their physical care? Does their family live nearby? Do they work full-time or part-time? Is that family member capable of overseeing the patient's medical care, such as medications or treatment? Do they have the cognitive ability to do that and the skills? Are they organized? Can they manage a care team and identify things that need to be changed if there's a problem? Do they have restrictions physically of what they can do? Not every caregiver can lift patients. Not every family member can lift patients or do bathing and dressing. And emotionally, are they able or do they want to assist in the physical management of their loved one? I mean, think about that. If you're married, do you want your spouse to do your bowel program or your bladder program? Now, some people, it doesn't change their relationship because, well, maybe if you're a nurse, you're used to doing that type of care and you're caring for your loved one, but not everybody can do that. So, and how long will that caregiver be able to provide this service? Are they already elderly and limited in what they can do? So all of these things come into effect. And then obviously the obvious things are, you know, do they live on a one floor home? Do they live up on the third floor? All these things can cause problems. Next. So there are different levels of injury from mild to moderate to severe and then catastrophic. The more severe injuries may require months of rehabilitation services before the patient could be discharged home. You can have a patient who is mildly impaired who may only need rehab for 2 weeks or maybe a month. And really their skill set is fairly good and they'll be able to achieve their goals before they go home. Or you can have a patient with a catastrophic injury which can result in acute hospital stay of months. From there, the patient may then be discharged to an acute rehab for 2 to 4 more months. And sometimes if they do not meet the goals that they need to meet to be at home, or they have significant medical problems that need to be resolved before they could go home, they could go to a subacute facility or a skilled nursing facility before they are discharged home. So, you know, we're talking about home care and we're going to get to that, but I just wanted to talk about these different types of options because these are things as nurses and healthcare providers that we deal with all the time. Let's start by going over the fact that for patients with mild to catastrophic injuries, they can be offered acute rehab or a subacute rehab, depending on how much therapy they can tolerate. An acute rehab facility offers up to 3 hours of therapy a day with all goals focused on maximum independence in the home, whether the care is done by the patient or the caregivers. Subacute rehab guarantees 1 hour of therapy per day and is often offered to patients who are unable to tolerate an aggressive 3-hour program, or they're able to tolerate it, but they have restrictions because of the kind of injury or illness they have. So they have to wait a period of time before they can be really aggressive and be weight-bearing. So subacute rehab is complete inpatient care for someone suffering from an illness or injury. Less intensive than acute rehab, but can be just as thoughtful and successful. And oftentimes when patients go in, they only offer them 1 hour a day, but if they can tolerate more, they will increase that program for them. They are very flexible. Most sites are anyways. Okay, and the goals remain the same in both acute or subacute rehab. Okay, so if the patient is then too medically needy to be discharged home, or there's no one to care for him or her, the patient may be discharged to a skilled nursing facility until the period of time that that medical problem resolves. This can be a patient who's not had enough strength to chew and swallow safely and keeps aspirating and getting pneumonia, or it can be a patient who needs IV therapy because of an infection, and wound care is needed. So nurses at home can do wound care or IV therapy, but there are often not enough nurses to fulfill that need. So in present day home care services, it's not unusual for the patient or the family member to be taught how to administer antibiotic IV therapy themselves, with an IV nurse that comes in once a week to assess the PICC line or IV line. And if the patient has severe ongoing medical needs, the patient then could possibly be discharged to a long-term acute care facility. So long-term acute care facilities are facilities that specialize in the treatment of patients with serious medical conditions that require acute care on an ongoing basis. So that could be a patient that actually is on a vent and needs to be weaned from the vent fully before he goes home. So possibly he'd be in the acute rehab and he'll have weaned off of it to a certain point, but still needs a lot of respiratory treatment. Or, as I said before, there are these ongoing aspiration problems, or ongoing infections, or medical conditions that occur. And so they might be referred to a long-term acute facility that can treat types of patients with all these medical needs. Next slide. So from that level, we would then possibly discharge the patient to rest home, group home, or residential home. So rest homes or group homes, these patients need less medical care, but don't have the cognitive ability to live independently. So maybe they had a head injury and they have some behavioral problems, or they have memory issues and need someone to remind them to take their medication or to bathe during the day, or whatever the issue is. A residential home is the same type of setting, but the patients require more care, and they are cared for by certified nursing assistants or LNAs or home health aides, pretty much on a 24-hour basis with nursing oversight. And it can include a multitude of services, including sending them to day programs or exercise programs. They can get physical therapy, occupational therapy, speech therapy, anything that they need in that residential home, and still get the more intense medical management with G-tube feedings and maybe seizure precautions because of severe seizures, maybe IV antibiotics, whatever they need. Another type of facility is an assisted living facility. These services here can range from having a room at a facility where the patient has their own living space, like a sitting room and bedroom and kitchen. They can prepare their own meals and take care of themselves as long as they can. And in addition, they can often eat within the facility or at a restaurant or dining hall if they choose. And the levels of care can vary. So when you are checking into an assisted living, you have to see what that standard fee covers. Normally it's just the basic room and board. So you can have in those settings a patient who requires no additional care to a patient who requires a nurse for medication administration, a home health aide to assist with bathing and dressing, and feeding, and food can be provided. They can start with minimal care, and more can be added if necessary. And usually assisted living facilities are affiliated or attached or part of a bigger system where they can then go into a skilled nursing facility as either their dementia deteriorates or progresses, or their medical condition deteriorates. And then the setting that we're here to talk about is home care settings. So home care settings are the best option for all patients, right? The goal is to keep people independent and living in their home. We want them to have the maximum medical improvement and quality of life possible. And this can happen in a multitude of ways. Patients can just need help with activities of daily living, such as bathing and dressing once a day, to intermittent care during the day, where someone needs to come in twice a day, maybe to fix a meal, or 24-hour per day care. And a multitude of services can be provided in the individual's home. Next slide. So in the home care setting, the rules and regulations and standards of care are dependent on each state. The guidelines I'm providing here in this talk are based on the state of Massachusetts. So when you're choosing a home care situation, agency, or caregiver, be sure to review the state regulations where they live and ensure that the person providing the care is the right person to perform that service. So there are all types of skilled services that are available in the home care setting. It can be an RN, a registered nurse. An RN would have attended a board-approved program, and it could be an associate's, a baccalaureate, a diploma, and a direct entry master's program. Upon graduation, the RN has to take and pass the NCLEX National Licensing Exam. And once they're graduated, ongoing educational classes must be completed to maintain that license. In addition to being a registered nurse, a lot of nurses have found a specialty that they're interested in and can achieve additional certification, and they can be certified as a rehabilitation nurse, an IV therapy nurse, a wound care nurse, and these programs also require additional contact hours and education on an ongoing basis. In addition, in the home setting and in many settings, you also have a nurse case manager. And a nurse case manager is a registered nurse who is overseeing the patient's care. They're evaluating the patient, putting in a plan of care, a treatment recommendations, and facilitating all treatment that has been recommended for the patient or that patient needs to achieve his maximum quality of life. We're here to be patient educators and their advocates in that situation. And the nurse case manager oversees the entire team in the home care setting to make sure that quality care is given. An LPN, or licensed practical nurse, must have at least 945 hours of combined theory and clinical practice in 5 required areas. 540 hours of them are in clinical practice. And the total hours should be no less than 1,080 hours. Once the educational program is completed, they must pass the required licensing exam through their professional credentialing services. And all of these services here are validated further by their specific states. So additional specialists that can come into the home really is just about anybody. In this day and age, there are so many different specialties and services available that if you can find a specific therapist who's willing to come into the home, they will gladly do that. Physical therapists, occupational therapists, speech therapists, respiratory therapists, psychological counseling like social work can also be done in the home. All of these, you know, it depends a lot on the availability of the specific therapists. Oftentimes they're in specific therapy programs or independent practices, and they're done at one site so the patient comes to them. It's harder to get people to come into the home, but it is done regularly. I find it specifically difficult, especially difficult, to get these types of services in the home for children. They're usually offered in the school system, and they're offered in facilities, or they're offered in independent practices, but it's difficult. It is possible if you have a payer source, but it is more difficult. And so all of those services can also be provided by an individual or by an agency of caregivers. And, you know, my preference personally is I feel that we should go through an agency. Caregivers, people get sick and have lives of their own, and things happen in those lives. So you don't want a shift of a specific shift that a caregiver is going to be working to be not covered. And when you are hiring your own caregivers, it's harder to be able to get that care in line. You have to have a really strong program and caregivers who are available to you to be able to provide a lot of care. So there are a lot of non-skilled nursing services that are provided in the home care settings. They can be a home health aide. These are employers that take a training program for work in non-medical home care agencies, assisting individuals in their homes. These are employees, excuse me. Certified nursing assistants, or CNAs, or licensed nursing assistants, depending on which state you are, take a 75-hour training program and sit for a state exam. They are registered at the Nurses Aid Registry. They can work in any environment that includes skilled nursing, such as long-term care facilities, rehab centers, and hospitals. State certified CNAs can work as home health aides, but not the other way around. In addition, while maintaining their license, they must complete CEU programs. There is a Red Cross training program that is available with 16 hours of hands-on training for CNAs to become certified. Another type of assistant is a personal care assistant. And personal care assistants work in the home to help with the basic care, such as getting patients in and out of bed, bathe, dress, eat, and other ADLs, as well as preparing food, keeping the house clean, food shop, and other instrumental activities of daily living. Personal care assistants are oftentimes hired directly by the patient or the family. And again, it's a difficult thing to do. I have actually had a patient who was a quadriplegic in the past who he arranges his own home care and hires them and does all the necessary paperwork, including providing workers' comp insurance and paying their taxes by himself. Now, he does this because he was an accountant before and he has great organizational skills. So although he's limited with his functional status, he cognitively is very capable of doing that. The problem with that type of situation is, as I said before, somebody could call in sick or someone needs to change a job, and then you've got to find another caregiver quickly, and that's not always easy to do. And he actually would spend 4 hours by himself with access to emergency contact if he needed it. And he was able to move around his house in his wheelchair, but it's not the best scenario in the event that an emergency happens. And we don't usually recommend that. There are agencies, both in states and nationwide, who help people set up home care in this setting. So Stavros is one that is in Massachusetts, and they will work with you to help you with the entire hiring and employee process. Family Caregiver Alliance also does that and acts and has the family caregivers act as subcontractors in this instance and provide the care to the patient. And both of those websites are here so that you can look at them and access their information. So you can have a live-in caretaker in the home that can be provided by an agency. You can have homemakers, housekeepers, and again, be a PCA if you're a family member, friends, and companion. Next slide. So just to go over the state requirements, within each discipline there are practice requirements and standards of care which mandate how the professional provides care. So in some states, for example, an LPN cannot give IV therapy, IV antibiotics, or start any IVs at all. Within each of these disciplines, there's also state requirements which govern how that practitioner practices within their state. So in some states, however, the LPN can get certified in IV therapy with additional training and provide the care. In addition, also, home health aides and CNAs or LNAs are also restricted in what they can do, but oftentimes with nursing oversight and RN oversight and instruction and follow-up and monitoring, they can complete some more involved medical treatment. And here's the website for Massachusetts to learn more about the nursing scope and standards of practice. Next page. Planning the individual's care for the long term. So what the patient needs now may not be what they need in the long term. Some considerations that you need to think about are deterioration of the patient's condition. An example of this would be a paraplegic who was injured at age 30, and now he's aged 50, and he's been using his arms as his legs to propel himself, to move himself all these years. When patients get to a certain age with that condition, they tend to have deterioration of the joints in the shoulders. And if a rotator cuff tears, that can be very impactful on that patient's lifestyle and independence. So all of those things have to be considered. At age 50 or 60, the patient may end up using a motorized chair and then need a wheelchair van and would need assistance to get in and out of bed. Or if he had a rotator cuff tear and he tore all of the tendons in the shoulder and they really could not be repaired, he would then be total care as if he was a quadriplegic, because he would not be able to do the things he needed to do to be independent. Aging can also be an impact. So if you are a young man and have a brain injury and you have cognitive difficulties, so you have problems with executive functioning and figuring out how to do things as you age, or fatigue because of illness. So in other words, let's say you got pneumonia, developed pneumonia, or some other general illness, sometimes that can further cause issues with your cognition. Just like when we're tired, we can't think as clearly. That injured brain has that same problem as people age. Change in the home situation and family relationships can occur. So we can't always take for granted that a family member is always going to be there. In addition to being a case manager, I'm also a life care planner. And so I work with people throughout their lifetime with care needs and do life care plans to identify what those care needs could be. So with a change in family situation, it can be very impactful on that patient if they're now living at home alone and need someone to care for them. Complications and exacerbations of their conditions can also occur, whether it's problems with a colostomy or problems with a catheter or with straight cathing and then having to go to a suprapubic catheter, or complications with diabetes, which then impacts on their entire physical well-being. All of these things are things that you need to plan for the future, and families need to plan, and the injured patient needs to plan so that they know what they're going to need in the future. Next page. So putting it all together, what are your resources? You need to choose the right facility or site for care, and make sure that you're choosing the right caregiver. Determine what levels of care and services needed per state guidelines to fulfill those needs. Determine the hours of service needed to fill the care needs. How long will the patient need this care? Are those needs long-term or for a specific period of time? And what are those effects of aging on the patient's needs? Are there any other conditions that may change in the future in the patient's environment that will change the care needs? So there are different scenarios that can happen and that I kind of wanted to go over. And so mild stroke needs to go home, but it still have a weakness of one side, such as paraparesis to the right arm and the right leg. You need to know who's living at home. You need to, if he's living at home with his spouse, but has to continue rehab to strengthen his body. So a home health, home health aides would be set up to go in the morning or the evening because the spouse is unable to lift him. He may also need PT or OT in the home. In more intense injuries and illnesses, the patient can have a catastrophic injury where he's paralyzed from the waist down. He may be in an acute facility until he's no longer making gains and then move to a subacute facility, then possibly to the home. but the home has to be modified before he goes into it because it's not handicap accessible. So that's something that also has to be considered. So oftentimes patients have to stay in a skilled nursing facility, and I actually had a patient whose family lived in an apartment on a 5th floor, and then he could not access the home because there was no elevator in it. So the patient had to stay in a skilled nursing facility, and we had to sign him up for housing, handicapped housing, and through the state. But there's a long waiting period for that. It can be up to 3 years. So because of that, families are often split apart until the proper modifications can be completed. Or other patients live in a trailer. How do you get a wheelchair in a trailer and live in a trailer? You can't do that. So either if they own the land and they can put in an addition, that's an option. But again, you're looking at accessible housing, which takes time. And then when they're home, what are their needs? A quadriplegic would need to be turned every 2 hours and would need 24-hour care. All of these things would be put in place. Therapy continues once they leave the subacute facility or the skilled nursing facility. For the transition to home, you'd get PT and OT in there. And then from there, some sort of day program where therapy is completed until the patient has reached his maximum medical improvement. And in Massachusetts, there's a program, Journey Forward, that we often use for quadriplegics or people with severe injuries, where they can a fee for an hour of work, and they can go and go as many times a week as they can tolerate, and it helps them stay healthy and functional. So putting this all together, if you're a nurse caring for a patient in the home, from experience, and I know from my 40 years of experience, how long home care is needed for that patient, how long it takes to bathe and dress them, how long it takes to do a bowel program, and if they are safe to be at home. If you're a non-medical person and have patients with severe injury, and if your case is in litigation, you may consider a life care plan. So as a life care planner, we evaluate and see patients in all different levels of ability and scenario. And a life care plan, which is a care plan over the patient's life expectancy, you can really outline clearly when that patient is going to need what they need and what their needs are. Next page. So getting started with MLCC is simple. We're happy to talk to anyone about what they think that they need in the home. You can call with any questions or concerns or send us an email through our website. And we're happy to assist you in determining what type of product is needed, whether you need a case manager in the home, whether you need a case manager to work with short and long-term disability, whether you need an estimate of care or verbal consultation regarding a case. We do medical chronologies, medical cost projections to outline what the costs are needed to care for a patient long-term. We do life care plan projections and comprehensive life care plans, as well as Medicare set-aside allocations, and do legal nurse consulting. This is all of our contact information, but please call if there's any questions or if I can help you in any way in determining what your patients need. We're happy to do that at any time.
All right, well, thank you so much, Cynthia. The information that you shared today was very valuable, and I do hope that the participants found it informative and can help them further determine the best home health solution for their patient, or if you might be a legal professional for your case. We're going to take this last few minutes to do a Q&A session, and we've gotten a few that came throughout your presentation. One is how do you know how many hours of care are required for each patient daily?
So I think for a non-medical person, that's probably a very difficult thing to determine. There's no special formula that you can use to say how long it's going to take. I've been in nursing for 40 years and have cared for patients with a multitude of diagnoses. And so based on that experience, I can determine how long they're going to need for different things. So if that patient just needs to be bathed and dressed in the morning, that really can be done very quickly in an hour, and get that patient up and get them moving. However, if that patient needs a bowel program done, uh, that will extend that time period probably by another 45 minutes to an hour. Uh, every detail, every task that is done throughout the day takes a certain amount of time. Most home care agencies have a minimum that they will send a home health aide into the home for, and most of them are 2 hours. Some are even 3 hours. So sometimes there's additional hours that are available. The other thing is not every patient wants to shower every day. So the elderly infrequently do that. So it may be a couple times a week that they'll be willing to shower, and it's a personal preference for every person. So oftentimes you'll see where a couple of hours are provided every day. The idea is to shift those hours as you need them. So that patient may need to go pick something up from the pharmacy. So a couple days a week will be put towards that. Or the patient needs to go to a doctor's appointment, or needs to go shopping, or just wants to get out. The home health aide can help in those scenarios also.
Thank you. We received another question. How do you adjust your care plans to take into consideration aging of the patient, like if they had a head injury and they're starting to age?
So, when you are working in home care, you're usually working for a certain period of time. There are home care agencies that specialize in just dealing with 24-hour care, whether it be a live-in caregiver, whether it be someone, different shifts, maybe 3 8-hour shifts or 2 12-hour shifts with a rotating schedule of caregivers. Oftentimes, the care is for a certain period of time. So when you're in general, when you're using a general home care agency, it's not always an advanced determination. It's really when you're working with someone long-term, like when you're dealing with a catastrophic injury, that you start becoming aware of the changes that happen in that time period and as they age. As I stated earlier, there are, after a head injury and a traumatic brain injury that can be pretty severe, oftentimes patients can recover and become functional. They're not the people that they were before, but they still have cognitive difficulties and problems moving forward. But they learn how to compensate. As they age, they may need additional caregivers around. They may need someone to help them with where before they were able to pay their own bills and to manage their household with just someone checking in. As they age, they may need more hands-on supervision and may need someone there 24 hours a day. It's very unique to each person. So as a life care planner, I have to look into that all the time and to make that determination because it's documented that as you age, there are changes that can occur, and you have to be aware of them, to watch for them, to make sure that when that patient needs additional care, you can set it in place.
Thank
I hope
you.
that answered the question.
Yes, thank you. We have another question. This person mentioned that you'd made reference of a life care plan or a life care planning. Can you further describe what is life care planning?
Sure. So not many people know what life care planning is. And actually, before I became certified in life care planning, I was doing life care plans and didn't even realize it. So we do care plans as nurses all the time, where they're for a set period of time, whether they're in the hospital or they're in home care, but it's usually a beginning and an end. Life care planning is really defining what the needs and goods are, the medical needs, the medical care the patient will need, and all the goods they're going to need for their entire lifetime. So that's taking into account all their physician appointments, all their therapies, all their durable medical equipment, their medications, transportation issues, architectural changes, surgical needs, any medical treatments that they're going to need, anything that this person could need throughout their lifetime, and kind of determine what they're going to need and when they're going to need it based on their injury or their illness. So it's, as I said, outlining their needs and how much that costs for their lifetime. And families often use these life care plans to care for their patients and follow it as a roadmap for their care for the future, how often they should see certain types of physicians, or how often they should have certain blood work done and be monitored, what they should be monitored for. And life care plans are also used to set reserves in insurance companies to determine how much money is going to be needed to take care of someone who's now being cared for that has a severe illness or injury. And it also can be used in litigation to also identify what the monetary amount will be needed to care for that patient for their lifetime. So it has a multitude of needs. But before I actually became certified as a life care planner officially, I had been asked to identify what their needs were going to be in the future, and we just extended it. And then once I learned what life care planning was, I joined the Association of Nurse Life Care Planners and became a certified nurse life care planner under their accreditation process.
Thank you, thank you. So we're going to give it about a few seconds to see if any other questions come through from our participants, and then we'll go ahead and wrap this up. While we are waiting for that, let's go back here. As a reminder, MLCC provides complimentary case consultation, so feel free to call or email at the contact information shown on this screen at any time to schedule a consultation or ask a question. All right, it looks like that is it for our questions. We want to thank our participants for joining. We do know there was a little technical difficulty in today's recording, so know that you can log on to our website under the webinars, and this will be available within the next 24 hours for on-demand playback. So just in case you missed any portion of this, you can access it there. Again, thank you for joining this webinar hosted by Medical and Life Care Consulting Services. We look forward to the opportunity to work with you. Thanks, everyone, and thanks, Cynthia.